Many men are in denial. They equate good erection and great sexual prowess with fertility. But the fact remains that around 50% of infertility has a male factor as a cause. Here are 15 causes of male infertility you should know. Number 1, infection. Infections such as chlamydia can affect the scrotum, it can affect the testes, and it can result in infertility. Number 2, testicular heat. There is a reason why the scrotum is outside of the body. It needs coldness. Anything that would heat up the testes would result in infertility. Number 3 is frequent sex. Can you believe that? If you ejaculate more than 3 times in a day, then, and your sperm is checked, you might find out that you have a low sperm count. And that's one of the reasons why we say abstain for 3 days before you come for your semen analysis. Number 4 is cigarette smoking. Cigarette smoking is a toxin. Nicotine affects the sperm cells. It can make them abnormal and it can reduce in low sperm count. Number 5 is alcohol abuse. Excessive alcohol can affect the sperm. It can reduce your libido, and it can also reduce the sperm count. Illegal drug use. Illegal drug use. There are some people that go to the gym and they use anabolic steroid. Those things shrink the testes. Use of cocaine and marijuana can also reduce your sperm count. Number 7 is retrograde ejaculation. Retrograde ejaculation means that instead of the sperm coming out, it goes back into the bladder. And this is very common in people with diabetes and multiple sclerosis. Number 8 is stress. Yes, we all know the kind of stress we go through in this country. Stress reduces your libido, and it can also reduce your sperm count. Number 9 are environmental issues. We spoke about that earlier on in my video. Smoke from generating sets and environmental pollution of the water system can also affect sperm. And not only does it reduce sperm cells or sperm count, it can give you abnormal cells. Number 10 is sexual dysfunction. There are a lot of men that go through what we call erectile dysfunction. It could be due to various things, but if you can't have an erection, then it will be near impossible to be able to achieve pregnancy. Number 11 is varicocele. Varicocele basically are veins that are around the testes, and they carry blood vessels. The more that blood that flows through those vessels, the more heat they generate, and they can also result in low sperm count. Number 12 are antibodies that attack sperm. Some men do generate antibodies on their own that attack their own sperm cells. If you think that might be the problem, then you might need to see a doctor so that they do an antibody check on you. Number 13 is undescended testes. There are some men that are born with their testes still inside the abdomen. Normally, the testes are supposed to come down and enter the scrotum. If you have undescended testes, then probably you might be suffering from male infertility. Number 14 is hormone imbalance. We all know the hormones that a man needs for fertility: testosterone, prolactins, and the rest. If for any reasons they are low, either to abnormal drug use, then infertility can occur. Lastly, number 15 is chromosomal defect. A normal man has 2 types of chromosome. We call it XY. A female has XX. But there are some men, they have 2 X's plus a Y. So they have what we call XXY chromosome. The syndrome is called Klinefelter syndrome. And in men that have those kind of syndrome, they cannot father a child. They suffer from male infertility. If you found this video helpful, please like and share. If you have any questions, please leave them in the comment section below. Thank you.